many ways, you've been in the belly of the beast. You have access to everyone who's been in the war zone. Sir Simon Stevens, who's declared like a war hero in Britain, was your protege. So the first question is, have we turned the corner? Are we over the worst, or are we still going to face a third wave?
I think it's a really difficult question. I think we are turning the corner. But I wouldn't underplay that this is still a raging pandemic. It's still a raging pandemic across the world. We're seeing death on a scale that we've never seen before. And when I look at the daily charts that come from what I think is the most reliable source, which is the Johns Hopkins University Coronavirus Dashboard, it leaves me still with some quite deep concerns. We're seeing, even in the United States, about 53,000 deaths per week from this pandemic. In Europe, the incidence of cases has continued to remain quite high, but the hospitalisations and death rates have come down. And this is quite reassuring because it shows pretty much the impact of the vaccines on our populations, and vaccine rates have gone up significantly. But we are at risk of normalizing death on a grand scale if we're too complacent about having turned a corner. For me also, I think the big challenge for the coming weeks is winter in the Northern Hemisphere, where our populations are more inclined to be indoors, where transmissibility could be greater, holds out a big challenge for all of us in the Northern Hemisphere. We're in the UK at the moment now quite worried about winter flu, which we have seen, shall we say, lowered immunity rates to as a consequence of the pandemic of the past 2 years. So yes, we're turning the corner. And I'm really reassured by some words recently from Sarah Gilbert, who's the Oxford professor who led the pioneering AstraZeneca vaccine, who says, well, in due course, this is going to be like the common cold. We'll grow used to it, and we'll have no greater winter or summer incidence than the common cold. But we're still a long way to go before we get there. There's still too much about the virus that we, frankly, just don't understand.
So Malcolm, in fact, that's another statistic I'd like to throw, that, in fact, just this week, UK still has gone up to 40,000 cases, which is different from what it was just a month ago. And as schools are opening up, there's a kind of even asymptomatic cases on the rise. But so, the unpredictability of the disease has been something that all leaders across the world have grappled with. And we spent the better part of 2 years really griping at all our leaders, but also understanding that it's a truly difficult situation. But if you were to pick the 3 top leadership lessons, the mistakes that leaders have made, what would you pick?
I think mistake number 1 was not taking it seriously. Right at the beginning, this thing that we sometimes call British exceptionalism, which is that we are unaffected by what happens in the rest of the world, and it's a very selfish, inward-looking concept. But we could see in February 2020 an exceptional peak of cases in Italy. And this just wasn't the impoverished part of Italy, this was one of the wealthiest parts of Italy, up in the north. And that should have triggered an immediate response.
Forgive me for butting in, but that particular mistake of not taking it seriously is well known. So I'd ask you to pick something which is, something which is a bigger takeaway, because by now we all know that no one took it seriously till it really hit us.
Well, I think it's related also then to the political response. I think that our government in Britain underestimated the willingness of the population to buckle down and to agree to a lockdown. So there was hesitancy. And also, Shoma, I think coupled to hesitancy is uncertainty and mixed messages, failures of communication. And I know this is true across the world, where the government of the time demonstrates that it doesn't seem to be on top of it, doesn't seem to understand it. This is complicated stuff. The science was really complicated. And it's not just the science, it's the risk profile. And governments across the world took time to do it. But let me give you one example of the challenges that we face in the healthcare system. And by the way, of course, I was no longer in a role in the NHS over the last 2 years, but we looked at what was happening in China. And you may recall in China, rapid lockdown, and then with military help, building fantastic new hospitals. Hospitals sprung up out of the ground overnight. And for us, that then proved to be, shall we say, a competitive challenge. So we created hospitals, we created Nightingale wards, the military came and set up 2,000-bed hospitals within the space of a week. We hardly ever needed them. But that to me demonstrates that you can make something that in retrospect looks like a mistake, but at the time was a vital insurance policy. So I've got some sympathy with political leadership in all of this. We will make mistakes always, but the question, Sherma, is this: what have we learned? What could we do better next time?